To begin, we need to understand that the major vessels of the face are most fed from the external carotid. The external carotid comes up and becomes a superficial temporal artery that feeds the frontal branch of the superficial temporal artery, which feeds the forehead. You also need to be aware that just anterior to the anteguinal notch along the jaw comes your facial artery. The facial artery is also very important as it feeds the mid-face and the nose. The facial artery is going to bifurcate into the inferior labial artery, the superior labial artery, and when it gets up to the nasal ala, it's going to become the angular artery. At this point, we're going to get small branches of the dorsal artery and then the nasal artery. Another important vessel to understand when we're injecting the midface is your infraorbital artery. That's going to be directly midline of your pupil, and you come down and you'll actually feel a little notch. The artery does angle downward actually as it comes out of the foramen, and you'll also have a little branch that comes across underneath the zygoma. As the facial artery comes up, it is near the level of the nasal ala, it's going to become the angular artery. Then we'll get some small branches that feed the nose, which is the dorsal, and the nasal. Directly approximately 2 centimeters from midline is going to be your supratrochlear and supraorbital arteries. The supraorbital is going to be about 1 centimeter lateral to the supratrochlear. These also feed the forehead.